Hi, this is Jonathan Jaroshow, publisher of the Diabetes Digest family of magazines and diabetesdigest.com. And I'm here today with Joy Pape, certified diabetes educator and a longtime writer for our magazine. And we're talking about resisting insulin. And this is a topic that Joy has written about a few times for us. And unfortunately, it's a topic that comes up frequently where a healthcare provider will tell their patient that they need to start taking insulin. And the initial reaction of the patient is that they're afraid. There are some psychological barriers and physiological barriers as well. You know, they're afraid of potentially the pain that it might cause them. So what are some of the ways that you've been able as a diabetes educator to help patients realize that insulin is really for their benefit and it's something that they should give a try?
First of all, you know, thinking about this, I don't know anybody that's standing in line to take insulin.
Right.
But what I do is, first of all, I want to see why they feel the way they do. Okay? So is it that they're afraid of needles? Is it that they have heard stories? I gather that information, and we've all got different stories. And then I ask them, especially when I'm in a classroom of people, who here uses insulin? Mm-hmm. And usually what I'll see is one hand go up, two hands go up, and these are the people that take insulin. So I ask the question again, who here uses insulin? Same two hands go up. I stop them and I say, we all need to raise our hands. We all use insulin. Some of us take it, some of us make it, but we all use insulin. And without insulin, we would be very sick. Our blood sugars would be very high. Now, there's a difference between type 1 and type 2 diabetes. In type 1 diabetes, the beta cells of people's pancreas stop making insulin. They need to take insulin. And if they don't get insulin, they're going to get a very high blood sugar and they're going to get very sick quickly. They know that. They've experienced it. They know that. But with people with type 2 diabetes, they don't know that. Okay? For the most part, people start off on pills who have type 2 diabetes. And then as the diabetes progresses, which type 2 diabetes is a progressive disease, even when a person is diagnosed with diabetes type 2, they've lost about more than 50% of the functioning of their beta cells. Mm-hmm. And it continues to do that. Mm-hmm. So anyway, but they've tried on pills, they've tried with food, they've tried with activity, can't get their blood glucose down. What happens is, as I tell people, I don't care how you do it, but what's important is getting your blood glucose down. And what's going on with diabetes is, even in type 1 or type 2, there's not enough insulin to bring the blood glucose down. So, and people tell me about stories they've heard, maybe Aunt Selma had to start taking insulin.
Or Uncle Harry.
Or Uncle Harry had to start taking insulin. And right after starting to take insulin, had complications. Maybe a stroke, maybe kidney failure, maybe an amputation. So they think that was the insulin. But what they don't understand is that it wasn't the insulin. It was the fact the person didn't get their blood glucose numbers down. Had they taken insulin earlier, they could have prevented those problems. So that wasn't the insulin. But the other issue is people don't want to take shots. Well, who does? But what people don't understand is it's not the way it was years ago. We've got brand new needles, brand new insulin, pre-filled pens. You don't even have to use syringes anymore. We've got something that looks just like a writing pen. And the needles are they're tiny.
Right.
In fact, what people don't understand is most people are checking their blood glucose, but it hurts more to check their blood glucose than it does to take an insulin shot.
Yeah, I think that's a very good point. And what I understand is in Europe, pen use is much more widespread than it is, I guess, worldwide than it is in America.
It sure is, and we're trying to change that. And I know the patients that I work with that use the pen, and most all of our patients I show pens to, they love it. They just love it. It's simple, it's portable, they feel like it's not a medical looking thing, they just love it.
Yeah, so I guess once you get them to try it, then they're, then I guess they're more willing to try it again, make it part of their routine. But until they see it, until they see it for themselves, like you said, that it's not going to hurt any more than it would to prick themselves, to test themselves.
It hurts less. I tell them that. And in fact, I can't even count to you the amount of people that have cried to me, because once they got over that, they tried that injection. What I will do is I give myself an injection, and I tell them, I almost didn't go to nursing school because I was so afraid of shots. Mm-hmm. And now I can give myself an insulin shot easily, so small, so tiny, can't even feel it. So if I can do it, they can do it. Mm-hmm. They do it, they see, they cry, thank you, Joy, they thank me, because now they're not afraid anymore.
What about someone who feels that maybe there's been a failure because they've had to start an insulin. I assume that's a common objection that you've heard.
Well, it's not that it's an objection, but they do try to bargain. Oh, I'll do this or I'll do that. And what they don't understand is it's not their fault. It's their pancreas's fault. The beta cells aren't working. And no matter what they do, it's not going to come down. It's not their fault. And when people come to understand that, they're very willing to go to the insulin.
Mm-hmm. Are there any other obstacles or barriers that you've seen that that maybe you can talk about to help others maybe overcome their own their fears or aversions to insulin?
Well, sometimes they've heard there's side effects of insulin, and there is a side effect to insulin. That is if you take too much, if things aren't balanced, and you can get low blood sugar.
Mm-hmm.
But so many of these people's blood sugar is so high, that's not a concern.
Mm-hmm.
But we've got these new insulins that act like our own body's insulin. So the side effects are nowhere like the stories they've heard and seen.
Right. So I guess, in summary, you have both improved devices in terms of devices that are less painful than even blood glucose testing, and you have insulins that are improved to the point where to the point where they're able to take them and not disrupt the flow of their day as they might have feared in the past.
Right. Right.
Okay. Well, thank you, Joy, for your time and
you.
for your educational perspective on insulin, and hopefully this will help people overcome some barriers to taking insulin.
Yes, and one more thing.
Sure.
A lot of times when people start taking insulin finally, they're thankful because they feel so much better and they were able to get their numbers down.
Okay, thank you so much.